For millions of people, winter brings a danger of flu and other respiratory illnesses.
Flu viruses can spread if you don't catch your coughs or sneezes hygienically.
For those who are older or more vulnerable, health authorities recommend the influenza vaccine as a way to get protected. But is the supply at risk? The flu vaccine cannot be stockpiled because the types of flu circulating may differ every year. This is hemagglutinin. It's a part of the virus that mutates over time. Here at the Francis Crick Institute in London, they've been helping the World Health Organization identify which strains of the virus to include in the vaccine. This usually happens in February in the Northern Hemisphere, with the vaccines delivered around the UK in August and September. But this year, it took longer to identify which strains of the virus to include in the vaccine, and this had a knock-on effect on the production schedule. It means for one of the main manufacturers, Sanofi, delivery of 20% of the supplies, over 1 million doses for at-risk groups, won't be delivered until after the 31st of October. Experts fear a no-deal Brexit could cause disruption. The company says there's enough buffer, but there are risks of delay at customs both in the UK and the EU.
In the world of vaccines, you get shortages more often than you do in medicines, for example, because of the complexity. Therefore, imagine in a world where it's difficult to get things into a country and there was a shortage of a particular vaccine. That's when you want to rush it into the country because in case there's a shortfall. And rushing things into the country in a period post-no deal Brexit might be a bit difficult, for example.
The fragility of the supply chain, coupled with the prospect of a difficult winter season, prompted doctors to write to the Prime Minister to say any Brexit strategy should include preparation for different flu scenarios. They're yet to get a response. Professor Andrew Goddard, President of the Royal College of Physicians, told Newsnight that the NHS has worked hard to prepare, but there's only so much they can do.
I can't sit here and say, don't worry, no deal will be fine, no one's going to come to any harm, no one's going to run out of medicines. What we can see is that we are likely to not have enough flu vaccine. We are likely to not have the vaccination coverage that we've had in previous years, and that is likely to have an impact on the NHS.
Health professionals have had an eye on the flu season in Australia. It's taken as an indicator about what to expect in the UK, but it's not always predictive. Official data show that the flu season started early there, with a higher number of cases than in most of the previous 5 years, but hospitalisations weren't that high. However, it caused more deaths than other flu strains in any of the past 5 years, other than 2017, which was considered to be particularly virulent.
So if we get a similar early peak in our flu, we would expect it to beginning to have an impact on GP consultations, admissions to hospital, and sickness in healthcare workers before Christmas. And if we haven't had the chance to get our vaccines and our staff vaccinated, as well as those within the population at risk of flu vaccinated, we're heading for a fall.
Doctors are not the only ones concerned. So are NHS trusts, even though they say they are used to dealing with uncertainty.
We're coming out of the summer, which has been a really tricky summer for the NHS. We are also facing a particularly virulent strain of flu, so that's going to put extra demand on NHS services. And then we're going to have the additional pressure of a no-deal Brexit, and we don't really know what that means.
It's not just about pressure on the NHS. There's an extra cost to all this extra planning. Sanofi, for example, have had to bear the brunt of this so far. But experts warn that this goodwill may soon run out and the extra costs associated with planning and delivery may fall to the NHS. With the NHS facing winter pressures, how will it cope with an increasingly likely no-deal Brexit?
Deb Cohen there, where we did ask the Department of Health for an interview about this, but nobody was available. In a statement, they told us they're working closely with vaccine suppliers to ensure they have robust contingencies in place. They added that what they want to reassure patients is that government plans should ensure that, whatever the circumstances, supplies of vaccines remain uninterrupted, when we leave the EU on the 31st of October.